In this quick little video here, we're going to explore how did values impact the evolution of the seniors program. So you will hopefully recall that in previous videos I introduced you to this seniors program. So just as a quick refresher, the seniors program was this group of people within a British Columbian health authority, and this group of people were trying to find ways to delay and prevent frailty in senior citizens. And you'll hopefully recall that these researchers actually found a way. They actually found a way that they could delay frailty in the elderly. And they wanted to spread this innovation throughout the healthcare region. However, when they started to approach vice presidents of the BC Health Authority, well, vice presidents were focused on overcrowding. They were given the mandate from the Ministry of Health to reduce overcrowding in hospitals. That was their main concern. And because they were so focused on managing overcrowding, when the seniors program came and said, hey, we'd like some help, they were like, sorry, we can't help you. We're busy focusing on overcrowding. When the seniors program went to physicians in the community, the physicians in the community were like, this is great. We love the idea of reducing frailty in the elderly. However, we also need to maintain the financial viability of our clinics. We have staff we need to pay, overhead we need to pay, and so on. Now, unfortunately, there's no billing code for the work associated with the seniors program, which means that we can't get paid for it, which means it's not financially viable. And so the doctors, even though they were pretty happy with the idea of reducing frailty, they weren't able to adopt it because they just could not afford to do so. So here we are, we have this situation where a group of people have found a way to reduce frailty, yet the organization, the system, is not able to adopt these changes for a variety of reasons. So what role did values play in this scenario? Let's have a look. So when we look at the researchers were using an instrumental value of innovation. So they were doing research. They were doing evidence-based research to learn how do we reduce frailty. Now, they were not doing research for fun. They weren't doing research for the sake of it. They were doing it in pursuit of the terminal value of public interest. We want to create a healthier population. So their terminal value was public interest. Well, let's have a look at the vice presidents. Let's have a look at the VPs. The VPs were also driven by a terminal value of public interest, right? Like it's in the public interest to reduce overcrowding in our hospital systems, right? However, the vice presidents were using different instrumental values to achieve that public interest. They were focusing on the instrumental values of robustness, sustainability, and accountability. Robustness, they wanted to make sure that the hospitals were robust, sustainable, that we could manage the capacity. They were accountable to the Ministry of Health. Their boss told them this is what to focus on, so they wanted to focus on it. And so we can see the sources for conflict here were these different instrumental values, right? So when the researchers said, hey, we have this new evidence-based program, the vice presidents were afraid that providing resources to that program would take resources away from their attempts at achieving robustness, sustainability, and accountability. So they didn't fight because they were pursuing different end goals, but they were using different means to achieve those goals, and that was where the source of the conflict was. All right. So by having a language of values, by understanding how values interact, we can start to pinpoint with precision points of resistance to our efforts. And more importantly, we can also start to see where there are potential bridges that we can build. So, for example, we can see that both the researchers and the senior vice presidents shared the same terminal value. They wanted the same end goal, public interest. They want to create, a healthy society. So even though there's this point of resistance, because we have this language of values, we can start to see with precision where we might be able to build a bridge between these two groups. Now, if we look a little bit closer, we can see that there are some other potential bridges as well. So you'll see for the vice presidents, one of their instrumental values was sustainability. So they want the hospitals to be sustainable. So we have a hospital today, we have hospitals tomorrow, we have hospitals 10 years from now, we'll always have hospitals. So they pursued this instrumental value of sustainability. Well, wouldn't our hospital system be more sustainable if we could create a healthier population of elderly people? If people were less frail, they would need fewer healthcare resources, and that would contribute to the sustainability of our healthcare system. And so there's this potential bridge here between innovation, the innovation that the seniors program was doing to prevent frailty, and sustainability. So there's another potential bridge that we can use to try to find common ground between these two groups. So by having this language of values, we can speak with precision about where points of conflict are, and we can also speak with precision about where there are potential bridges that we can cross the divide between two groups. So I have focused here on the researchers and the vice presidents. Why don't you take a little bit of time and think about the relationship between the researchers and the physicians in the community? What are the terminal values that each group is pursuing? What are the instrumental values that each group is pursuing? Where are the points of conflict? And where are the potential bridges? Why don't you think about that for the researchers and the physicians in the community? Otherwise, we'll see you next lesson.